Hey everybody, it's Dr. Drew, the Movement Doctor. And today we're going to talk more about the series on no more pain. And today we're going to be talking about the shoulder. So some of the common shoulder injuries that we see in overhead athletes or really anyone that plays any kind of activities is rotator cuff tendonitis, shoulder impingement, instability in the shoulder, like you've had one dislocation and now it's constantly moving around in there. And then also a labral injury, shoulder labral injury. So what we're going to talk about is just a few exercises that really target these, and it really targets all of them because you really want to focus on shoulder scapular stability. So one of the common things that people end up doing is more of the open chain exercises where the elbows are on the side and they're moving like this, maybe with some resistance. Those aren't bad, but if you really want to get into really being efficient with your time and your exercises, you really want to focus in on closed chain exercises for the shoulder. That'll help with any diagnosis as long as there's no pain in the shoulder joint. So we're going to go over 3 specific exercises that are more closed chain specific that can really help strengthen the scapular thoracic area and where the glenohumeral joint is, right where the humerus attaches to the scapula. So the first exercise we're going to do is focusing on lifting up through the scapular thoracic muscles. So you have your client or yourself lay perfectly side lying. Your arm is going to be at a 90-degree angle here, rotating out. And the idea is you're going to lean your weight forward. You're going to put the pressure through the elbow here, and you're going to lift up the scapula. You want to make sure that everything gets lifted up, even all the way through the pelvis. The key thing here when you're coming down to help focus in on more of the scapular muscles is now when you're coming down, you're going to hinge backwards, where now eccentrically all of these scapular thoracic muscles, specifically serratus and lower trap, are functioning at the highest capacity. And you should really feel it right along the scapular area. When you come back up again, focusing up on all of this, and then you hinge backwards right in this area, right there. Do that one more time, pushing through the elbow here, and then coming up, feeling this, get the core on, and you're gonna lean slowly back, hinging onto that. You're not just falling backwards, you're hinging backwards off of the scapula. So now a progression from that exercise is now coming up all the way onto your forearm here. This leg is across the top. This arm can be hanging up around the top. You're going to lift up the pelvis. And then from here, now when we do internal-external rotation, when we're doing this exercise, what we're focusing on here is that the humerus is moving on a stable scapula. This is open chain. Now what we're going to do is we're going to move the scapula over the fixed humerus. So now this is the scapula is going to move over this fixed humerus here. Now you're doing that same idea of what your motion is here, but now it's opposite. Now it's scapula on humerus. You should really feel all of this rotator cuff muscles turning on. Helps with stability in the glenohumeral joint for those with instability. If you have labrum pain, you can take it to small ranges until you don't have any pain anymore. Again, maintaining pelvis up. Everything should be in a straight line right here. And now you're just rotating just like that. Now the final exercise here is in a quadruped position. We're going to work specifically on Serratus Anterior. Feet on contact to the ground. You're going to lift up the knees off of the ground here. And what you want to focus on is that they maintain external rotation here without turning their hands. And all you're going to have them do is just dip a little bit where the scapula is and come up into like a plus position. Down, everything else maintains the same, and all it is just right in that scapular thoracic area. Maintaining external rotation in the humerus the whole time. Up here. Good. Down. And again, the feeling should all be in the scapular area. You want to get away from strengthening more on the deltoid, because that biomechanically moves up the humerus and it's going to be hitting the acromion. So what you want to do is strengthen all of the muscles all around the scapulothoracic area. So that concludes our topic on no more pain with the shoulder. Some higher level exercises that you can do to help strengthen the shoulder blade, the scapulothoracic area. And all of this should be done pain-free. If you can, please like and subscribe our page, and look forward to seeing you guys in more series that we talk about to get rid of all of your pain. Thanks.